You know, the blood flowing through a healthy heart is usually smooth and silent. But every now and then, when a doctor listens in, they hear something extra, a whoosh, a rumble, a murmur. So what is this sound, and what is it trying to tell us?
So here's our game plan. First, we'll nail down what a heart murmur actually is. Then, I'll give you a super simple toolkit for describing any sound we hear. And finally, we're going to put that tool to work and diagnose some of the most common murmurs out there.
All right, let's jump right in. First things first, what in the world is a heart murmur? The best way to think about it is like this. Normal blood flow is like a perfectly smooth, quiet river. A murmur, on the other hand, is the sound of rushing, turbulent rapids. Now, sometimes this can be a totally normal physiological finding, but it can also be a really important clue that something's up with the heart's valves. Okay, so if we hear one of these sounds, how do we investigate it? How do we make sense of it all? Well, we need a toolkit, and ours is a simple but really powerful mnemonic, script.
This is it, script. It's our 6-step framework that turns a kind of confusing sound into a crystal clear profile. By systematically working through these 6 characteristics, we can go from just hearing a noise to understanding exactly what's happening inside the heart.
First up, S is for sight. Look, the chest isn't just one big listening post, right? Where you hear that murmur the loudest is a huge clue to which one of the heart's 4 valves might be the source. Are we listening over the aortic valve, way up here? Or maybe the mitral valve, down at the apex? Location, location, location. It's everything.
Now, intensity is graded on this 1 to 6 scale, and it gets pretty wild. At grade 4, the vibration is so strong you can actually feel it through the chest wall. That's what we call a thrill. And get this, a grade 6 is so loud you can hear it with the stethoscope off the chest. That's insane. But here's the key takeaway for you. Most harmless or innocent murmurs, they're quiet, usually a grade 1 or 2.
All right, let's put this into practice. We're going to tackle our first set of cases, the systolic murmurs. These are the sounds you hear during the heart's contraction, right between that first lub and the second dub heart sound.
We're going to look at 2 absolute classics here. First, aortic stenosis. That's when the aortic valve gets all narrowed and stiff, making it tough for blood to get out. And second, we've got mitral regurgitation, where the mitral valve is leaky, so blood starts flowing backward. 2 totally different problems.
Okay, let's run aortic stenosis through our script framework. We hear it loudest over the aortic area, and yeah, that sound travels up into the carotid arteries in the neck. But the real signature clue? It's the character. It's a crescendo-decrescendo murmur. It starts quiet, gets louder, hits a peak, and then fades away. Kind of like a diamond shape if you were to draw it out. That's the unmistakable sound of blood fighting its way through a super tight valve.
But wait, there's more. Beyond script, other clues really help lock in the diagnosis. You might find a narrow pulse pressure, basically a smaller than usual gap between the top and bottom blood pressure numbers. And why does squatting make it louder? Well, think about it. That position literally shunts more blood back to the heart, which just amplifies the sound as it tries to squeeze through that narrowed valve.
All right, now for mitral regurgitation. This one is a high-pitched, blowing sound you hear right at the heart's apex, and it has this unique habit of traveling towards the armpit. But the defining feature, the thing you absolutely have to remember, is its character. It's pansystolic. What does that mean? It means you hear that whoosh of the leaky valve through the entire contraction, from the lub all the way to the dub, with no break, just a constant whoosh.
Okay, time for our next set of cases, the diastolic murmurs. Now we're listening for sounds that happen after that second dub heart sound, when the heart is supposed to be relaxing and refilling with blood.
So, aortic regurgitation. This happens when the aortic valve gets leaky. We run it through script and we find a high-pitched, blowing murmur. The key things to notice here are its timing. It kicks off right at the beginning of diastole, and its decrescendo character. It starts loud and just kind of fades away. And this condition comes with some absolutely fascinating clinical signs. You've got the water hammer pulse, a really strong, forceful pulse that just drops off suddenly. And in some cases, you can actually see things, like Corrigan's sign, which is a visible pulsing in the neck, or even de Musset's sign, which is a rhythmic head nod that's perfectly in sync with the heartbeat. How wild is that? Next up is mitral stenosis, a narrowed mitral valve. For this one, you're listening for a low-pitched, rumbling sound, right in the middle of diastole. And often, just before that rumble starts, you hear this very distinct opening snap. That's the sound of the stiff, sticky valve being forced open by the pressure building up behind it.
And the other clues that point towards this? You might find a low-volume pulse, and sometimes you'll see a malar flush.
It's this reddish color on the cheeks, and it's a sign of the chronic low oxygen levels that can happen with this condition. All right, just one more piece of the puzzle. Let's talk about a crucial clue that helps us figure out if a murmur is coming from the right side of the heart or the left. And you know what? It all comes down to breathing. It's that simple. There's a great mnemonic, RILE. It stands for right-sided murmurs increase with inspiration. The flip side is that left-sided murmurs often get louder with expiration. Why? Because when you breathe in deep, you pull more blood back into the right side of the heart, which naturally makes any murmurs over there louder.
Let's take tricuspid regurgitation as our example. Now, on paper, it sounds a whole lot like its left-sided cousin, mitral regurgitation, right? It's a high-pitched, pansystolic, blowing sound. But here's the dead giveaway. Its intensity goes way up when the patient takes a deep breath in. That specific finding has a name, Carvalho's sign, and it tells you, hey, we're on the right side of the heart.
So there you have it. You see how having a system is everything, right? By combining our script framework with other clues, like timing and even just how a patient breathes, we can start to translate these really subtle sounds into a clear diagnosis.
And really, this isn't just about naming sounds. It's about being a detective. It's about piecing together all these little clues to understand the incredible, intricate story of flow and pressure and function that's happening inside the heart with every single beat.